Hi guys, this is Narsa Reddy, a second year medico from Government Medical College, Mahbub Nagar. Today let us discuss about squamous cell carcinoma of skin. Squamous cell carcinoma is the second most common type of carcinoma that occurs in sun exposed sites of skin. So now let us discuss about the risk factors. Risk factors are exposure to ultraviolet radiation and arsenic exposure and human papilloma virus strains 5 and 8. This is very important to remember as it could be asked in entrance exams like NEET and INICT. And immunocompromised patients, those patients who have undergone chemotherapy are generally immunocompromised and are more susceptible in getting squamous cell carcinoma. And radiation exposure is also a most important factor that leads to squamous cell carcinoma, and tobacco chewing also leads to squamous cell carcinoma. These are all risk factors. So now let us discuss about the genetics. Xeroderma pigmentosum is a skin condition in which nucleotide excision repair pathway mutation. When there is accumulation of nucleotide excision repair pathway mutation, it leads to squamous cell carcinoma. Now the second genetic thing is, normally we have learnt in neoplasia chapter that when there is damage in DNA in sun exposed patients, these damaged DNA gives signals to ATM and ATR kinases. ATM and ATR kinases are checkpoints that give signals to P53 gene. We all know that P53 gene is a tumor suppressor gene. This P53 gene arrests the cell cycle at G1 phase of the cell cycle, and after arresting the cell cycle, it leads to DNA repair or elimination of the damaged cells. This is the normal process, we all know that. But there is mutation in P53 gene, it leads to squamous cell carcinoma. So it is most important to remember that P53 mutation. And increase in RAS signaling is also a pathway that leads to squamous cell carcinoma, and decrease in NOT signaling also leads to squamous cell carcinoma. Now let us discuss about the pre-malignant conditions of the squamous cell carcinoma. First pre-malignant condition is actinic keratosis. It generally occurs in sun damaged skin and exhibits hyperkeratosis, means maximum keratin production or excess keratin production. It appears grossly as cutaneous horn-like lesion on skin. Some lesions produce much keratin, so it appears as cutaneous horn. This is gross appearance. So now let us look at into microscopic appearance. Microscopic appearance is associated with dysplastic cells or atypical cells with hyperkeratosis and parakeratosis. This is microscopic picture. And now let us discuss about the second pre-malignant condition is carcinoma in situ. The progression of atypical cells into entire full thickness of the dermoepidermal junction. But there is no breach in basement membrane. It is a pre-malignant condition, so there is no breach in basement membrane. So as there is no breach in basement membrane, the atypical cells cover the entire dermoepidermal junctions. It spreads through the full thickness of the membrane, but there is no breach in, or there is no tear in the basement membrane. So now let us discuss about the malignant condition. As carcinoma in situ can progress into invasive squamous cell carcinoma, in which there is breach in the basement membrane or tear in the basement membrane, where abnormal or atypical cells progress through basement membrane. Grossly, it presents as proliferative or ulcerative lesion. This is the picture in which there is proliferation and ulceration, and in some books it is mentioned as cauliflower-like lesion. So microscopically, as I have already said, that atypical squamous epithelial cells have breached the basement membrane as mentioned in Robbins and invade deeply into the dermis. Means there is breach in the dermoepidermal junction. And if we look carefully, there is enlarged and prominent nucleoli. See, this is the picture in which breach in the basement membrane can be well appreciated. So we all know that there is keratin pearls is the characteristic feature of squamous cell carcinoma. Pink cell in every squamous cell carcinoma is also known as keratin pearls. Now there is broader classification which is very important for NEET, PG or higher ICT. So based on production of keratin pearls, it can be divided into well differentiated squamous cell carcinoma, moderately differentiated and poorly differentiated squamous cell carcinoma. In well differentiated squamous cell carcinoma, keratin production is maximum. There is maximum production of keratin pearls. And in moderately differentiated squamous cell carcinoma, as that by name it suggests that there is little bit production of keratin, means there is little keratin pearls. But in poorly differentiated squamous cell carcinoma, as by definition there is minimal or little to no minimal keratinization or keratin pearl production. So here ends the topic, and thank you.